What is a brain aneurysm? Brain aneurysm is a entity where there is a small bleb in the blood vessel in the brain, mainly in the arteries of the brain. So these blebs are nothing but an outpouching in the blood vessel wall, which can rupture and cause torrential bleeding in the brain. Or sometimes when they are big enough, it can compress on the nearby structures, causing symptoms. How does one understand a rupture of brain aneurysm? Common symptoms are severe headache. Patients report to us as a type of headache which is worst headache of their life. And they can also have loss of consciousness. They can have difficulty in moving one side of the body. And also, if not ruptured and causing compression on the nearby structures, they can have common symptoms which they can have would be difficulty in moving the eyeballs, leading to double vision. And then if at all it ruptures, then they can have other symptoms which I have just mentioned. So once this is identified, we do an imaging of the brain, either in the form of CT brain or in the form of MRI brain. And then we do an investigation called diagnostic subtraction angiogram, which is nothing but an invasive investigation where we inject dyes into the blood vessels in the brain to identify the bleb which is there and just caused the bleeding. So if a bleb is found or if an aneurysm is found, then we tackle the aneurysm so that we can prevent the further bleeding. If an aneurysm has bled, the chances of it to rebleed within 24 hours is extremely high. So we need to tackle this entity as an emergency and then give necessary treatment so that we can prevent rebleeding. And if a rebleeding occurs without the treatment, the chance of surviving also becomes very less. Hence, we need to treat this entity if ruptured. If not ruptured, then we can keep the patient under medical observation. Or if there are symptoms because of the compression, then we definitely need to treat. What are the ways in which we can treat an aneurysm? There are two ways. Either we can do surgery, which is an open access way, or we can do endovascular treatment, which is a minimal invasive treatment where we go in from the artery in the groin, and then with the help of catheters and wires and tubes and with the help of coils, we can seal the aneurysm and then prevent rebleeding. Or if unruptured, then we can seal the aneurysm so that the rupture can be prevented. Or if the compression is there, that can be reduced. What are the different ways of endovascular approaches for treating aneurysm? We can do simple coiling, we can do balloon-assisted coiling, we can do stent-assisted coiling, we can do flow diverters, we can do intrasaccular device deployment. These are the different ways of approaches which we can endovascularly perform so that an aneurysm can be treated.